Welcome to Nurse Navigator, Medical and Surgical Nursing, Objective Questions and Answers. Which of the following is a modified risk factor associated with coronary artery disease? Obesity, heredity, gender, age. The answer is obesity. Glycated hemoglobin HbA1c tests, mean glucose levels over the past 7 days, 30 days, 90 days, 120 days. The answer is 90 days. Which of the following blood group is a universal donor? A negative, AB positive, O positive, O negative. The answer is O negative. Type of shock seen in burns cases: hypovolemic, cardiogenic, neurogenic, none of the above. The answer is hypovolemic. Restless leg syndrome (RLS) is seen in hypercalcemia, hyperphosphatemia, chronic renal failure, hyperkalemia. The answer is chronic renal failure. The nurse working in the nephrology department is handling 4 patients with the following diagnosis and is well aware that obesity is not a feature of hypothyroidism, adrenal insufficiency, hypogonadism, Cushing's syndrome. The answer is adrenal insufficiency. Which among the following indicated the nursing theory of self-care, self-deficit and nursing system? General theory of nursing, whole person theory, nursing process theory, crisis theory. The answer is general theory of nursing. Information given by the client about his disease is known as sign, symptom, observation, diagnosis. The answer is symptom. A body temperature of 39 degrees centigrade is equivalent to a Fahrenheit temperature of 99.8, 100.4, 101.6, 102.2. The answer is 102.2. Amount of solution used for evacuant enema in adults: 100 to 250 ml, 250 to 350 ml, 500 1000 ml, 1000 1500 ml. The answer is 500 1000 ml. DOSH is the temperature for tepid sponging: 15 to 18 degrees centigrade, 18 to 25 degrees centigrade, 27 to 37 degrees centigrade, 40 to 45 degrees centigrade. The answer is 27 to 37 degrees centigrade. Which among the following statement is given by the nurse to explain about Wong-Baker pain scale? It has faces representing from no hurts to hurt worst. In this assessment, ask the patient to choose the face that best depicts the pain they are experiencing. The score of Wong-Baker scale is from 0 to 10. All of the above. The answer is all of the above. Position used during pleural tapping is orthopneic, supine, prone, knee chest. The answer is orthopneic. DOSH is the nursing modality which is also known as task method. Primary nursing, functional nursing, team nursing, case method. The answer is functional nursing. Following are the principles of documentation, except appropriateness, correct spelling, accuracy, effectiveness. The answer is effectiveness. Skilled personnel who provide follow-up visits, post-discharge, to a patient's home for the delivery of nursing services are called community nurse, home health care nurse, scrub nurse, clinical health care nurse. The answer is home health care nurse. The premature closure of the sagittal suture is called scaphocephaly, oxycephaly, acrocephaly, anencephaly. The answer is scaphocephaly. A condition in which placenta is directly attached to the myometrium. Placenta battledore, placenta velamentous, placenta previa, placenta accreta. The answer is placenta accreta. The pH of amniotic fluid is 6.8 to 6.9, 7.1 to 7.3, 7.4 to 7.6, 6.7 to 6.8. The answer is 7.1 to 7.3. Which of these is considered as dangerous? Placenta previa, type 2 anterior, type 1 posterior, type 1 anterior, type 2 posterior. The answer is type 2 posterior. Nagel's rule is used to calculate cervical dilation, amniotic fluid, gestational age, expected date of delivery. The answer is expected date of delivery. WHO recommended number of antenatal visits are 4, 8, 12, 6. The answer is 8. As per recent guidelines, active phase of labor begins at 3 centimeters, 4 centimeters, 5 centimeters, 6 centimeters. The answer is 6 centimeters. Maximum function of corpus luteum occurs at ovulation, before ovulation, 3 days after ovulation, 8 to 9 days after ovulation. The answer is 8 to 9 days after ovulation. A disease spreads very widely in a community or specific geographic area are called endemic, epidemic, sporadic, pandemic. The answer is epidemic. What is used to find out the amount of residual chlorine in water? Ozonation, ultraviolet irradiation test, Horrocks apparatus test, orthotolidine test. The answer is orthotolidine test. The number of new cases occurring in a defined population during a specific time period is incidence, rate, proportion, prevalence. The answer is incidence. Which committee is known as the Health Survey and Planning Committee? Kartar Committee, Bohr Committee, Shrivastava Committee, Mudaliar Committee. The answer is Mudaliar Committee. The germ theory of disease was propounded by Donvantry, Louis Pasteur, Hippocrates, John Snow. The answer is Louis Pasteur. The Bohr Committee was set up in 1943, 1948, 1949, 1952. The answer is 1943. Disability limitation is which mode of prevention? Primordial prevention, primary prevention, secondary prevention, tertiary prevention. The answer is tertiary prevention. National Family Planning Program was launched in 1952, 1958, 1948, none of the above. The answer is 1952. The goal of phototherapy in a newborn is to promote respiratory stability, decrease the serum conjugated bilirubin level, decrease the serum unconjugated bilirubin level, prevent hypothermia. The answer is decrease the serum unconjugated bilirubin level. Rule of 10 is used for imperforated anus, cleft lip, tracheoesophageal fistula, Hirschsprung disease. The answer is cleft lip. Poor skin turgor in neonates and infants indicates hypoglycemia, hypocalcemia, dehydration, hypertonia. The answer is dehydration. Apgar score system contains all of the following criteria, except respiratory rate, color, level of consciousness, Heart rate. The answer is level of consciousness. A pediatric nurse knows that the most common assessment finding in a child with ulcerative colitis is intense abdominal cramps, profuse diarrhea, anal fissures, abdominal distension. The answer is profuse diarrhea. All are the parts of the triad of cystic fibrosis, except pancreatic enzyme deficiency, fever, high concentration of sweat electrolytes, COPD. The answer is fever. Most suitable position for a child who come to OPD with the complainant of epistaxis. Supine position, prone position, sitting position, lithotomy position. The answer is sitting position. Most common type of meningitis that affects children less than 5 years is idiopathic meningitis, aseptic meningitis, bacterial meningitis, tuberculous meningitis. The answer is aseptic meningitis. Chest radiography of children with foreign body aspiration are always abnormal, may show overinflation of the involved lung, always show the foreign body, commonly show pneumothorax. The answer is may show overinflammation of the involved lung. Which among the following is not a type of observation seen in psychology? Controlled observation, naturalistic observations, participant observation, complete participant. The answer is complete participant. In Erikson's theory, adolescents develop a sense of initiative, intellect, identify, industry. The answer is identify. Adaptive mechanism of giving excuses when a person cannot solve a problem. Projection, substitution, rationalization, composition. The answer is rationalization. Delusion is a disorder of perception, thought, memory, judgment. The answer is thought. Thanks for watching. Like, share, subscribe.